me adjust. Can you see me clearly and clearly? Let me shift to the back. I want to talk about vaginal discharge. What is normal and what is not? What is normal and what is not normal? So first of all, to all ladies out there, vaginal discharge is a normal thing. It's a normal thing because some people believe that if they see discharge like this, is no good. Any discharge is no good. That is not it. This vaginal discharge has its own function, and there is a normal vaginal discharge and there is an abnormal vaginal discharge. So you just have to know the difference between the two. And that's what I want to do on this live. Okay, so the vaginal discharge that is normal vaginal discharge. First of all, what is vaginal discharge and where does it come from? Vaginal discharge is a clear fluid and it used to be a milky white coming from the glands that are within your vagina and your cervix. This vaginal discharge is not just there ordinarily without any function. It's helping you, in case you don't know. So this vaginal discharge helps to keep your vagina moist. It helps to keep your vagina lubricated. It keeps it clean. It even maintains the pH balance of your vagina. So you can see that it plays a huge role in your health. But you need to know which one is normal and which one is not normal, because as a lady, all this thing is very important. So for you to know a normal vaginal discharge, it used to be clear, stretchy. You know that kind of stretchy, how can I, let me say, egg whites, the fresh egg that has not been cooked, unboiled egg, the white one. You see how stretchy it used to be? Exactly. So that's how vaginal discharge used to look like. It will be stretchy, it will be clean, no odor, is odorless, and it does not itch. Not the one you be having one itching or irritation. That is no vaginal discharge. So a normal vaginal discharge is supposed to be clear, supposed to be slippery, watery, kind of, not too watery, but slippery and stretchy. That's for the normal one. Now for the abnormal vaginal discharge. Okay, wait, before I go to abnormal, there's still one thing I want to tell you about vaginal discharge. That is, the discharge you have can vary from month to month. And vaginal discharge also varies from a person to another. What one person is experiencing might be different from what you are experiencing. So don't match the two. And it usually change due to lots of things. Just put it back, shift. All right, sorry. So from it changed from a lot of things, due to a lot of things. For example, your vaginal discharge can vary due to age, due to days of your menstrual cycle. It can vary due to breastfeeding. Maybe you're a breastfeeding mother, it can impact it. Also, your vaginal discharge can vary if you are pregnant, if you are in menopausal stage. Yes, it can also vary in these aspects. So individual differences, you don't compare. What you should be concerned about is which one is not normal. Okay, so for you to know an abnormal vaginal discharge, it used to be thick. The first one I'll be saying, it will be thick, it will be cheesy, like clumsy, that kind of cheesy that looks like cheesy like this. Yeah, it used to be thick and kind of the sometimes it used to be, how do I explain it? It's something that comes with it has odor. We will return it. Look it up. Okay. It has odor. It can be itchy. It can be causing burning sensation. It can cause irritation. A lot of things that surrounds an abnormal discharge. Okay, but there are a lot of categories to it. If you are experiencing a yellowish, greenish vaginal discharge, this is not a normal vaginal discharge. So far it is yellowish or greenish. If it is brownish or it has blood, okay, if vaginal discharge is brownish or it has blood, contains blood, and you notice that you are not even within your period, you are not doing your period at this age, and you are having a brown or bloody vaginal discharge, this can be due to irregular periods. When your period is not regular, it can be due to that. So try and monitor your vaginal discharge to know what is right and what is not right. And you see that bloody or brownish vaginal discharge, it can result to cervical cancer. Although this case is rare, it's not that common, but it can become severe to that extent. Depends. So there are some vaginal discharge that also have this fishy odor, itching, irritating, like that. So loads are due to yeast infection, some are due to bacterial infection, some are due to, that's bacterial vaginosis, some are due to trichomoniasis. So all these are characterized by it. So the best thing I will advise you is to note whenever you are having a vaginal discharge that is not characterized by the normal one that I first of all mentioned, see a doctor. If your vaginal discharge is accompanied by irritation, itching, you are itching so much that you are even enjoying to itch, you are enjoying the itchiness, it's just as if you should continue itching it, then something is wrong. When you have pain while you're urinating, something is wrong. So you need to get checked. If you see blood in your discharge, if it's brownish, if it's greenish, if it's yellowish, if that's fishy odor, you need to get checked. So those are the things I want to point out, the key points I want you to know, so that you can differentiate your vagina. And there's one thing I want to also point out. Sometimes there is all these should I say, it's not deep yellow, like yellowish vaginal discharge that used to stain your pants and leave it bleached. If you notice your panties, it can leave it bleached, like something bleaching. So due to that yellowish discoloration, is because your vaginal discharge is acidic. Imagine putting acid on the surface of something, you will see the effect, because that surface is going to change. One kind change, like bleaching. That's exactly how it is. But in this case, this acid is harmless. Rather, it is helping you. It is preventing infection for you, like vaginal infection for you. Okay, so it's not all vaginal discharge that is bad. I've mentioned what you need to know about normal vaginal discharge and the abnormal one. So if you see all this yellowish acidic one, it's due to the acid that your vaginal discharge is producing, and it is helping you. It is harmless. It is harmless. Okay, then if you let me give you one illustration. Like during the, how do I start, before your ovulation period, like days before your ovulation period, your vaginal discharge starts to thin out, to become more thinner, you get, and although watery too. So why you approach, let me say on the day, like during your ovulation, that time of ovulation, God, is to be very, very thin, more thin, more slippery, more watery. And at this time, some girls used to need to use panty liners. In fact, not only some girls, at this point, if you're close to your ovulation, you can notice The vaginal discharge starts to become more thin, more slippery, more watery. That's the moment when you used to need a panty liner or even pads, depending on individual, the amount of discharge individual spill out. Okay, so that is that. Then after your ovulation, it starts to thicken, but not the thickness, not the thick. It starts to thicken and reduce. So that's how the although some women usually use this to track their ovulation period, because they know that when the ovulation is, whenever they see that they have a thin vaginal discharge, a watery, slippery, they will know that my ovulation is nearby. Is nearby. Let me just let me just prepare towards my ovulation. And during the ovulation period, they notice that it is more watery, more slippery. And can you guess why it is like that? This is because when sperm, for example, you have sex during this period, sperm will be able to flow, swim up to the cervix with the help of the slippery environment of the vagina. They can easily swim on it to the cervix and go and fertilize egg. So that is how it is. That is how it is. And that is what I want to give you today. I hope you gain one or two things from this video, from this live stream. Okay? I hope you gain one or two things from this live stream. I'll be expecting your comments. If you have any question relating to vaginal discharge, I'll be ready to answer you. So you just don't have to worry, especially if you have you notice an abnormal vaginal discharge. You just have to be very conscious, because I know that some ladies do overlook vaginal discharge. Like, even though it's yellow, if it is sticking, they believe since they are not feeling anything, even though they are itching, you will not feel anything, and this can cause an adverse effect. So the moment you start itching, you are perceiving some foul smell, just go and see a doctor so that they can give you an appropriate treatment. Don't go over the counter and be buying something from chemist. The doctor know better. They know what is right for you. They want to find out the kind of vagina, because there are different kind of vagina infection. There's different kind of abnormal vaginal discharge treatment. So you don't use what you use for bacterial vaginosis. You don't use what you use for bacterial vaginosis to treat what is used for yeast infection. So they know how to segregate the treatment and give you the right one. So all right. See you guys in the comments. Bye.